Healthy habit.
The cardiac conduction system is designed for electrical impulse creation and propagation. It allows for initiation of impulses in the atrium, slowed conduction in the atrioventricular (AV) node, and rapid propagation through the His-Purkinje system to allow synchronous contraction in the ventricles. An electrocardiogram, or ECG, is a simple and useful test which records the rhythm, rate and electrical activity of your heart. Electrode placement V1 4th intercostal space to the right of the sternum, V2 4th intercostal space to the left of the sternum, V3 midway between V2 and V4, V4 5th intercostal space at the midclavicular line, V5 anterior axillary line at the same level as V4, V6 mid-axillary line at the same level as V4 and V5 RL anywhere above the right ankle and below the torso, RA anywhere between the right shoulder and the wrist, LL anywhere above the left ankle and below the torso, LA anywhere between the left shoulder and the wrist. The P wave in an ECG complex indicates atrial depolarization. The QRS is responsible for ventricular depolarization and the T wave is ventricular repolarization. There are different ECG tracing that we should know.
A normal ECG trace includes a P wave, a QRS complex, and a T wave.
The ECG findings of an acute anterior myocardial infarction wall include ST segment elevation in the anterior leads, V3 and V4, at the J point and sometimes in the septal or lateral leads. Depending on the extent of the MI, this ST segment elevation is concave downward and frequently overwhelms the T wave. Atrial fibrillation is a condition that causes an irregular and often fast heartbeat. Symptoms of atrial fibrillation include heart palpitations, dizziness and shortness of breath. Sinus bradycardia is a cardiac rhythm with appropriate cardiac muscular depolarization initiating from the sinus node and a rate of fewer than 60 beats per minute, BPM. The diagnosis of this condition requires an ECG showing a normal sinus rhythm at a rate lower than 60 BPM. Sinus tachycardia is a regular cardiac rhythm in which the heart beats faster than normal. While it is common to have tachycardia as a physiological response to exercise or stress, it causes concern when it occurs at rest. Supraventricular tachycardia, SVT, is an irregularly fast or erratic heartbeat, arrhythmia, that affects the heart's upper chambers. SVT is also called paroxysmal supraventricular tachycardia. Torsades de pointes is a type of atypical heart rhythm. It occurs when the lower chambers of the heart beat faster than the upper chambers. Shows like a ribbon-like trace. Ventricular fibrillation, VF, is the most important shockable cardiac arrest rhythm. It is invariably fatal unless advanced life support is rapidly instituted. ECG findings in ventricular fibrillation, VF, chaotic irregular deflections of varying amplitude, no identifiable P waves, QRS complexes, or T waves. Asystole, colloquially referred to as flatline, represents the cessation of electrical and mechanical activity of the heart.
Thank you for watching.